Welcome to All Things Public Health with Alvin Capitaco. On this show, we bring you expert interviews, discussions, and stories about public health. Join us as we explore public health topics that are of interest to you, our esteemed listener.
Welcome to yet another episode of the All Things Public Health podcast with me, Alvin Capitaco. My guest today will be talking to us about rheumatic heart disease. Take a listen. Dr. Shimanda, thank you so much for taking the time to have a meeting with me. Please introduce yourself to our listeners.
Okay, so thank you actually for hosting me on this podcast and actually very much appreciate the platform and the initiative because we are actually trying to do our best to get, things going on regarding awareness creation for rheumatic heart disease, not only in Namibia, but globally actually. So it's really a very nice initiative and a good platform. Yeah, so myself, my name is Panduleni. Shimanda is my surname actually. So my background, I'm a registered nurse. I had worked as a registered nurse before, and then I have done my postgraduate education, which is including now my master's and my PhD in public health, health economics, and global health. So those are my major areas that I'm focused into now. My main research area, especially during my PhD research, it's on rheumatic heart disease in Namibia, and then of course the global level as well. So that's how I am actually in this area of rheumatic heart disease.
Okay, so before I get to the second question, what sort of motivated you to study rheumatic heart disease?
Okay, well, yeah, that's a nice question. I get it quite a lot. But yeah, usually you find that it's actually majority of people researching on it. It's cardiologists, you know. Well, during my years back then when I worked as a registered nurse, I had actually dealt with or cared for a lot of young people with rheumatic heart disease. So it kind of started off from there. Of course, by then I did not really we never kind of think of to say, I'm going to research about this in the future. But then you find yourself in the future and then you just have like an interest on something, and then when you try to trace back, how did this come about? But it's mainly actually started off back then when I worked in the hospital as a registered nurse, I had taken young people with this disease, and it's quite a very severe disease. So yes.
You said it's quite a serious disease?
Yeah, very serious. It's very serious.
Okay. Yeah, so that is actually my next question. Like, how prevalent is it in Namibia? And also, if you could just explain to our listeners what rheumatic heart disease is.
Okay, yes. To give a short overview of what rheumatic heart disease is, it's a very I would not want to scare off the listeners from the beginning, but it's quite a very complex disease to explain actually on how it come about. Yeah, so rheumatic heart disease, as by the name, it's a disease of the heart. It is a damage that happens to the heart valves. Yeah, and then this damage originally is caused by a bacterial infection that's quite common infecting the throat. Yeah, so
it just starts off with a sore throat.
yes. Yeah, so in the process of the disease, it is that one gets a sore throat, and then a sore throat, of course, these infections are caused by different organisms. Yeah, so there are some that are caused by this specific bacteria that somehow actually causes a reaction in the body. Yeah. And
What bacteria is this? Sorry, Doc, I didn't get what you said. What bacteria is that?
So that's it's a type of a group A Streptococcus bacteria. So it's not all the bacteria, but there's a specific bacteria which is like a part of in a group A Streptococcus bacteria that causes a reaction in the body, actually, which we refer to it as autoimmune response. Autoimmune response, this is when bacteria in the body that somehow contains DNA characteristics that are similar to of the normal body cells. So in the when the body reacts to fighting this bacteria, it as well damage the normal body, tissues in the process. Yeah, so that's actually how it comes about. So now with that, now mostly you get the damage on heart valves and in some other areas of the body as well, like in joints and stuff. Yeah, but then the heart valves mostly are the ones that, the consequences are much severe. So now when the heart valves are damaged, now they can either be damaged that the damage is huge from the beginning, or sometimes it gets more worse and more worse as the person gets more infection and more infections, as they live on.
What demographic of the population are likely to get it? Like, who does it affect the most, and how is it preventable, if at all?
Yeah. So okay. So now it's in terms of the demographics. At the moment, by the numbers, we actually find that it's much more prevalent among women and, of course, young people.
Wow.
Yes, and
Okay.
young people. So research is still going on, still trying to understand actually why is it much more prevalent among women compared to men. Yeah, so there's still not yet clear evidence to actually explicitly say why. Yeah, and then it's among young people, especially age group under 30 years old. Yeah. Yeah. So and then children. Yeah. So now this process of the disease, it is that mostly we are getting this sore throat when we are kids, or in children, and then mostly you find that rheumatic heart disease itself will start showing or coming out when they are maybe like in late teenage or in the early 20s. Mostly people are picking it up in their early 20s. So when you become more active
So
and
the damage happens in childhood, but then it only manifests in their teens?
yeah, not necessarily to put it that way, but it is that
Okay.
mostly the sore throat it's happening in childhood. Yes, but then commonly you find that it manifests when people are in their late teenage or in early 20s. Yeah, and then most
Okay.
is because mostly that those are the age when people are more active, Yeah. So, but of course, it manifests across in all age groups. Yeah, but commonly find that it people are more detected when they are especially in the early 20s. Yeah, and then of course, mostly it is that people are more active in that age group, So yeah. So
Okay.
in terms of demographics, so it's mostly young people, women, and children. Yeah. Now the question around prevention. So rheumatic heart.
Yeah. Why is it like primarily prevalent in low and middle income countries?
Yes. Okay.
And
So
yeah.
yeah. So in principle, rheumatic heart disease is preventable because, as we had said, it's actually a consequence of a bacterial infection, and as we know, bacteria they can be effectively treated with antibiotics. Yeah. So
Right. Yeah.
the prevention of rheumatic heart disease lies in treating the bacterial infection effectively so that they don't cause the damage in the body, and then as well preventing or avoiding these infections in the first place. So those are your main areas. So if it's either if the person gets an infection that we must treat them on time, or we actually prevent that they don't get the infection. Yeah. So now the question of why is it only now prevalent in low and middle income countries? It is that in high income countries, people have improved their living conditions. They've improved access to care. The whole social status have improved. So in that, it is that the risk of transmitting infections it's very very low or very minimal. And then when people get the infection, of course, they go to the hospital early and then they get treatment and then they complete treatment and all that. So in principle, that actually is one of the main reasons why that it's no more prevalent in high-income countries, even though even though the science is not yet 100% clear on exactly actually how or why it is not there anymore. Because like for instance, just for like for to make it for the interest sake, I go around and ask cardiologists from high income countries and I ask them, is this bacteria still in your country? And then they say yes. And then I'm like, why is it not causing the rheumatic heart disease? And then they say we don't know yet. It's just one perspective of saying like, is it that the bacteria is no more in high income countries? No, 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 the bacteria is there. It's the reaction. So yeah, there's still not 100% answer of why it is not prevalent there anymore, because there are as well components of genetics on the whole disease issue. So yeah, so there's a lot of unanswered questions set in that aspect, but mainly it's actually attributable to the prevention of transmissions through improved living conditions, access to care, and then timely treatment as well of infections. Yeah, so that's for now, that's what we go with, to say yes, those countries, they've improved the living conditions, the socio-economic status, and then so yeah.
Let me take you just a little bit back, doctor. So how will an individual know that the cold they have is actually dangerous and might lead to rheumatic heart disease? Are there signs, and what are they?
Okay, yes. Now, with now sore throat, now there's now the question of which one is which, Yeah. So with the sore throat itself, we actually want to encourage that people get or seek treatment for when they have sore throat, especially when it's clear that it's bacterial, because you have sore throat that some are actually viral or caused by like just the common cold virus like influenza, and then you have now the ones that are caused by the bacterial, so mostly bacterial infections, mostly like people are coughing, there's like it might be mucus and stuff like that. Yeah. So now the signs, because now we said that rheumatic heart disease itself is now that you have heart valves damaged. So in the process of when the body gets to react to this bacteria, as we had said, the signs and symptoms that usually would come out will be fever. You will have pain like in the joints. You can have like some include as well like movements of like of the body limbs, like arms and so, like uncontrollable, that they just move or they are just making movements on themselves, like shaking and like that. So those are some of the symptoms that actually now those will be, or we call now symptoms for, or that stage we call it rheumatic fever. So with rheumatic fever now, that's because now that's kind of like when there's this reaction in the body, and then it's now those episodes that when they occur and occur over and over, like that, you get the valve damaged or the heart damage now itself. Yeah, so mostly, so you have like swollen, you can get swollen ankles or elbows. You have the sore throat. You can get now this jerky, uncontrolled movements of like arms or legs. You can have like some people can have as well fast breathing, or feeling sort of breath sometimes. So those are your common symptoms now for that period. So, but in general, of course, we want that then the people seek care for sore throat, just to make sure that they are actually not getting this rheumatic fever in the process.
Yeah, thank you so much for explaining what the symptoms are and what people should be on the lookout for. So I'm sure you are aware that February is Heart Month.
Yes.
And I feel like it's mostly in the US. But what I want to know is like, is there a specific month in which Namibia sort of creates awareness around rheumatic heart disease? And also, what activities do you normally have, like just to also sort of create awareness, basically?
Okay, so well, so far there's actually no much of a specific date or period that is
Mm-hmm.
actually specifically dedicated to rheumatic heart disease. There are for some other heart conditions like hypertension or congenital heart disease, like in February, actually. Yeah, but overall, rheumatic heart disease, you would find that mostly it would be coming out in September because in September, like 29 September, you have like the World Heart Day. So usually,
World Heart Day. Okay.
World Heart Day, is it 29 September or 20 September? No, 29 September.
Okay.
Should be 29 September. Usually that's as well when you find rheumatic heart disease as well, things coming out. But then, of course, that's a general World Heart Day. Yeah, but
Okay.
commonly, like now here in Namibia, commonly that's as well when you find this awareness campaigns as well coming out, yeah, 29 September. So there are several groups led by people living with rheumatic heart disease. Uh,
Mm-hmm.
yes, that are working in collaboration as well with the clinicians, the cardiac clinic, and then we work collaboratively with. Yeah, so they do activities for creating awareness, including seminars or events, especially events on celebrating of World Heart Day. Yeah, they do as well interviews, radio and such, of course on social media as well. Yeah. So those are mainly the activities that are being done. So there is no yet like very broad, large scale awareness activities being done, but yeah. So at the moment, it is those, like radio interviews, seminars, and then this now like organizing events, like for instance for the World Heart Day. Yeah, yeah, but most
Okay. Yeah.
these groups mainly they are led by people who are living with rheumatic heart disease. Those advocates, and then yeah, we give them support at the clinic and that.
Thank you so much. Yeah, is there anything else that you feel you'd like to share that I might have missed?
Okay. Yeah, no, I don't think there's might be much you have missed in terms of the question, but perhaps it's just to, like kind of emphasize on the importance actually of knowing and learning about rheumatic heart disease. Yeah, so it's actually very important that people are aware, so that people are actually able to get treatment early or seek care early for sore throat, especially children.
Mm-hmm.
Yeah, so that in the end, we get to actually prevent these severe outcomes of these simple infections now, including rheumatic heart disease. Yeah, so I think that's really is one of the main areas actually I would just emphasize on.
So basically, just for people to go out, like if they have symptoms of rheumatic heart disease or rheumatic fever, um, is what your message is to the public as well, is it?
Yes. Okay. Yeah. So maybe we can summarize that a little bit into different groups. Just hopefully to bring up a bit of clarity. Yeah. So
Mm-hmm.
you have in stage one, you have where people have, or they especially children, they have a sore throat. Like just this our throat infection. So we want to actually get them to the clinic so that they are assessed, and then the healthcare workers are able actually to assess and treat this, whether it's need but antibiotics or not. Yeah, so that's a very important stage. Yeah, so now in that stage it's a little bit difficult to talk about symptoms because there we are just talking about general sore throat of the children. Hmm?
Mm-hmm. Mm-hmm.
Now we will now come in stage two. Stage two, now here we are now talking about rheumatic fever. Now, in the stage of rheumatic fever, now here can find symptoms, So you will have that this person will have a sore throat, and then they will have a fever. You can find them to have swollen or very painful and swollen elbows and ankles, like where in the areas of the joints, like ankles, knees, and elbows and wrists, You can find some can have like some just jerky, uncontrolled movements, like where you are, the person might be lying, but you can see like they are kind of like arms are kind of like almost kicking, like they're jerking. So they can have as well symptoms of, for instance, like maybe they are breathing too fast or such. So now that stage now is of rheumatic fever. So now, unfortunately, we find so many people with rheumatic heart disease, but they do not remember having any symptoms of rheumatic fever. Some don't even remember at all having like or suffered from sore throat, apart from, like just remembering generally that, everyone as a child, they kind of had some kind of sore throat, but did not really pick out to say, yeah, maybe, I had those severe sore throat or so. So there's really still that part of, you really get a lot of people with rheumatic heart disease, but don't remember having these symptoms or so. But then those are symptoms you want to look out for. If I'm putting it like, let me put it as now, like group B or group 2. Now, in group 3 itself, now, this will be now rheumatic heart disease itself. Because then one can have this rheumatic heart disease, but they don't know, because you can only know if you come to the hospital and then you are screened, and then, like they do echocardiogram screening on the machine, and then they are able to pick it up and see. But then the symptoms now for rheumatic heart disease itself, because now in rheumatic heart disease stage itself, the heart valves are already damaged. So if you will have problems now, there you will have problems that will relate to heart issues. So you will have, like, for instance, getting tired fast when you might be working, or might be lying down, feeling sort of breath, like struggling to breathe. Maybe you will find maybe challenges like when you are doing heavy work, and you can be getting maybe chest pain sometimes. Yeah. So there you will have now these general symptoms that would kind of relate to, like that kind gives you a hint actually that your heart is struggling as you are working, or you are doing things. Because now when your valves are damaged, it's mostly that sometimes they are damaged that when the blood, when the heart is pumping the blood, you can find that some blood might be kind of leaking back. That makes it difficult for the heart, as it's pumping, and as the blood should be going out to the other parts of the body. Or it can be that the valves are not opening fully, that, it's not enough blood being pumped through out. So now in that stage of rheumatic heart disease itself, we as well want the public actually to be able to pick out these symptoms that would be relating to, issues with the heart. And then they should be able to go to the hospital as well, because then it's as well another challenging area, because you can be going to the hospital, and then you can be explaining, for instance, maybe saying like, when I'm running, or when I'm working out at the gym, or when I'm doing, like just heavy work, or, like normal physical work, I get tired so fast, I struggle to breathe, or I have chest pain sometimes. So sometimes you get these symptoms and they are too general that, they are not so easily picked up, you know? So then maybe people will more tell you like, okay, you must rest more or take some multivitamins, like that, kind of related to that. Maybe you are just tired, maybe you have done a lot of work. So we want as well now to be aware of these symptoms and pick them up, so that actually people are able to be picked up with, if they perhaps maybe have rheumatic heart disease actually while it's still early, because then you get as well that people live with the disease for so long in the end that it's detected when it's actually in a very, very severe stage. Maybe they are already in heart failure, or, or they are very, very sick that they are admitted, and then it's when people are picking it up. And then if you ask them, they will tell you, for instance, no, I've been having this, feeling this tired and, struggling when I'm working and things like that for, like for some years now. And when I go to the hospital, for instance, or to the clinic, might be given some multivitamin or just told to rest and take some leave from work, Yeah. So in summary, I would actually kind of group into those three stages so that people are actually able to be picking up in different areas of the disease spectrum. Yes.
Thank you so much, Dr. Shimanda, for explaining that also, and for telling our listeners what they need to look out for. And yeah, thank you so much also for your time.
Yes, no, thank you, Alvin.
That was Dr. Panduleni Shimanda educating us on rheumatic heart disease. Thank you so much for listening to this episode of the All Things Public Health podcast. Until the next one, bye-bye.
Thank you for listening to All Things Public Health with Alvin Kapitako. If you enjoyed this episode, please share it with others, post about it on social media, or leave a rating and review on Spotify, Podbean, and other podcast platforms. Also, follow us on social media at All Things Public Health Podcast to engage with us.